Okay, after knowing about the detail about the mediastinum, let us start the each content. So first we are going to learn about the superior vena cava. So what is superior vena cava? It's the largest venous channel which drains the upper half of the body, including the head and neck and upper limb also. So how does the superior vena cava is formed? It is formed by union of right and left brachiocephalic vein behind the lower border of first costal cartilage. And then it is lies parasternally and running in a downward direction up to the lower border of third costal cartilage, where it is ultimately drained into the right atrium. But if we see the course at the level of sternal angle, the superior vena cava is piercing the fibrous pericardium, and so that its course will be divided into extrapericardial part above the sternal angle and intrapericardial part below the sternal angle. So in the lower part, it is covered by fibrous pericardium. Developmentally, that you already know about the development of the vessels, the heart tube, which is having a venous end, which is having a sinus venosus, and which will receive both side common cardinal vein on the right and the left side, and each will having a drainage of anterior and posterior cardinal vein. Now further, there is an oblique communication occurs between the right and left anterior cardinal vein, and part above right anterior cardinal communication, right anterior cardinal vein will forms right brachiocephalic, while oblique communication and left anterior cardinal vein above that communication forms left brachiocephalic vein. And now the superior vena cava is formed by the lower part of anterior cardinal vein, which is going to form extra pericardial part of superior vena cava, while right common cardinal vein is going to form intrapericardial part of superior vena cava, while the upper part of right posterior cardinal vein, which is form arch of azygous vein, while on the left side left anterior cardinal vein is disappear and forming ligament of left vena cava. Left common cardinal vein will going to form oblique vein of left atrium, while left horn and body of sinus venosus is going to form coronary sinus. Now after knowing that development, let us see what are the relations of superior vena cava. In front, it is related with the chest wall with intercostal space. Now internal thoracic vessels, right margin of lung and pleura is related with the superior vena cava in front aspect. While if you see the behind, it is related with the trachea and right vagus nerve and root of right lung. While on the right side, it is related with the phrenic nerve with pericardiocophrenic vessels, and furthermore right, it is related with the right lung and pleura. And if you see on the left side, it is related with the ascending aorta in a lower part and brachiocephalic trunk on the upper part. What are the tributaries? The formatting tributaries of superior vena cava we already know, that is right brachiocephalic and left brachiocephalic vein, which unite to form superior vena cava. Another major tributary is azygous vein, which is arches over the root of right lung and ultimately terminate or drain into the superior vena cava just before the superior vena cava is piercing the fibrous pericardium. In addition, it will also receive the pericardial and mediastinal veins. Now the clinical anatomy related with the superior vena cava. We have already know the development and normal architecture of superior vena cava. Now if left side of anterior cardinal vein is persist and oblique communication is not develop or disappear, it will lead to double superior vena cava, and among which left superior vena cava is open through the coronary sinus to the right atrium. Now sometimes what happens, right anterior cardinal vein is disappear and only left side will be possessed, and that will give rise to left superior vena cava. Now this superior vena cava may be obstructed by any thromboembolism, and that can be of two variety. Either it is above the azygous vein or the below the azygous vein. If it is occurs above the azygous vein, azygous venous channel is still patent and draining into the superior vena cava. So that channel is remain patent and major draining channel will opening as a collateral for that superior vena cava obstruction. So which are that channel? So most of the upper half of the body that will be draining through internal jugular and subclavian will ultimately draining into brachiocephalic vein, which will receive tributary as an internal thoracic vein, but now blood flow is reverse. Now from the internal thoracic vein to the anterior intercostal vein, which is anastomosis with the posterior intercostal vein, and ultimately it will drain into azygous vein, and ultimately from the azygous vein blood is draining into the superior vena cava and ultimately reach to the heart. So this one is the major channel which is draining the blood when SVC obstruction occurs above the azygous. In addition, there are few other collateral channels like you have already seen in the rectus sheath. So that internal thoracic vein which is having a tributary superior intercostal vein, which is anastomosis with the inferior epigastric vein, which is ultimately drained into external iliac, to common iliac, to inferior vena cava to ultimately reach to the heart. In addition to this channel, there is another channel which you have already learned in upper limb, that there is anastomosis around the scapula. So the axillary vein to the subscapular, to the circumflex scapular, to ultimately it is going to the posterior intercostal vein to azygous venous channel. In addition, the superficial channel is also there, where axillary vein is having a lateral thoracic vein, while the great saphenous vein is having a superficial epigastric vein, and both is connected by thoracoepigastric vein. So from lateral thoracic to thoracoepigastric to superficial epigastric, ultimately it is reached to femoral vein, to common iliac, to inferior vena cava, to the heart. Now if that obstruction occurs below the azygous vein, the venous return through the azygous channel is now obstructed. So which channel is remain open? That superficial channel which we have already mentioned, that will be open, because ultimately now blood has to flow through the inferior vena cava to reach to the heart. And another channel which is in the rectus sheath through internal thoracic to the superior epigastric to inferior epigastric to the inferior vena cava to the heart. And if that superior vena cava obstruction occurs below the azygous vein, superficial veins will get engorged, and we may see a large vein on the thorax and abdominal wall, and that may be seen in a reflex way, as we have seen in the caput medusae. That part of also going to be seen.